Yes, I think we should be really focusing on one main takeaway. We talked a lot, for example, about how the COVID-19 has impacted our world. I mean, we all know of the massive crisis in long-term care facilities, the fact that there is an overlap between the constituency that has been hit the most by COVID-19, people over 70s, and our constituency, people who have dementia. But one of the major takeaways, I think, is to look at what's happening with COVID-19 now. We see that where successes are made is when people work together in trying to develop solutions, in trying to understand what this is. And I think this really explains what we need to do with dementia. Dementia is not something that is going to be tackled by one country and one country alone, or even regionally by one group of countries. It's a global problem. And this is why at Alzheimer's Disease International, we advocated so cogently and so passionately for having a global action plan on dementia at WHO, because we feel that in its component parts, each component parts, it's kind of incredibly complex in itself. Just to remind you, there are 7 component parts of a global action plan. There is policy, there is risk reduction, there is diagnosis, there is care, support for families, treatment, long-term care, and dementia readiness and friendliness, of course, data and research. So there is just so many things that it does need to be looked at as its own plan. And unless we act on this all together, unless all countries are in there together, and unless people all over the world join together in asking their governments for change, we are not going to see change. And so I, in particular, but also my co-panelists, were asking the constituents of your audience. You know, neurologists are very important to this discussion. Healthcare professionals are extremely important. So we are the first ambassadors. We need to tell people that more needs to be done. If it doesn't start from us, nobody else is going to do it for us. We do need to take conscience of the fact that there is a lot of disinformation. We cannot rest on our laurels saying, oh, we know about this, so obviously everybody knows about this. People don't know about this. Challenges like risk reduction, people still don't know what they can do in order to reduce the risk of developing dementia. People still don't know what are the main warning signs they may have developed Alzheimer's disease or any of the other paths to get to dementia. So we do need to take action, and we do need to become the first ambassadors. And this is a global problem. So we do need to work together across countries and take the good practice of a country and bring it to another. In part, that's what IDI has done during COVID. We've taken the lessons learned in China, in Japan, in South Korea, in Taiwan, and we have made sure that our members all over the world have been able to access those first, which has enabled them to be way more ready to cope with the current crisis.